Review chart for any limitations in physical activity. Identifying limitations prevent patient discomfort and injury. Bringing necessary equipment to the bedside stand or over bed table. Bringing everything to the bedside conserves time and energy. Perform hand hygiene and put on gloves and/or other PPE if indicated for preventing the spread of microorganisms.
Okay, sir, good morning. I'm Marjorie Madelo, your nurse for today, and you are? Okay, sir, so today, sir, I'm going to give you a bath. Is that okay with you? Okay, sir. So if you feel something is wrong with the procedure, just let me know, okay, sir? Thank you.
Close curtains around bed and close door to room if possible. Adjust the room temperature if necessary. This ensures the patient's privacy and lessens the risk for loose body heat during the bath. Offer patient bedpan or urinal. Voiding or defecating before the bath lessens the likelihood that the bath will be interrupted because warm water may stimulate the urge to void. Remove gloves and perform hand hygiene. Hand hygiene deters the spread of microorganisms. Adjust the bed to a comfortable working height, usually elbow height of the caregiver. Having the bed at the proper height prevents back and muscle strain. Put on gloves, lower the side rail nearer to you and assist patient to side of the bed where you will work. Gloves prevent transmission of microorganisms. Having the patient positioned near the nurse and lowering the side rail prevent unnecessary stretching and twisting of muscles on the part of the nurse. Loosen top covers and remove all except the top sheet. Place bath blanket over patient and then remove top sheet. Place soiled linen in laundry bag. Take care to prevent linen from coming in contact with your clothing. Remove patient's gown and keep bath blanket in place. If patient has an IV line and is not wearing a gown with snap sleeves, remove gown from other arm first. Lower IV container and pass gown over the tubing and the Container. Rehang the container and check the drip rate. Raise side rails. Side rails maintain patient safety. Fill basin with sufficient amount of warm water. Warm water is comfortable and relaxing for the patient. It is also stimulates circulation and provides for more effective cleansing. Then lower side rail closer to you when you return to the bedside to begin the bath. Lay a towel across patient's chest and on top of bath blanket. This prevents chilling and keeps bath blanket dry. Put on gloves if necessary. Gloves are necessary if there is potential contact with blood or body fluids. Fold the washcloth like a mitt on your hand so that there are no loose ends. Having loose ends of cloth drag across the patient's skin is uncomfortable. Loose ends cool quickly and feel cold to the patient. With no cleanser on the washcloth, wipe one eye from the inner part of the eye, near the nose, to the outer part. Soap is irritating to the eyes. Moving the inner to the outer aspect of the eye prevents carrying debris toward the nasolacrimal duct. Rinse or turn the cloth before washing the other eye. Rinsing or turning the washcloth prevents spreading microorganisms from the one eye to the other. Then bath patient face, neck, and ear. Apply appropriate emollient. Use of emollients is recommended to restore and maintain the skin integrity. Next, dry your patient's face, neck, and ears. Apply appropriate emollient. Expose patient's forearm and place towel lengthwise under it. Using firm stroke, wash hand, arm, and axilla, lifting the arm as necessary to access axillary region. Rinse if necessary and dry. Apply appropriate emollient. Spread a towel across patient's chest. Lower bath blanket to patient's umbilical area. Wash, rinse if necessary, and dry chest. Keep chest covered with towel between the wash and rinse. Pay special attention to the folds of skin under the breast. Lower bath blanket to the perineal area. Place a towel over patient's chest. Wash, rinse if necessary, and dry abdomen. Carefully inspect and clean umbilical area and any abdominal folds or creases. Return bath blanket to original position and expose far leg. Place towel under the far leg. Using firm stroke, wash, rinse if necessary, and dry leg from ankle to knee and knee to groin. Apply appropriate emollient. Wash, rinse if necessary, and dry the foot. Pay particular attention to the areas between toes. Apply appropriate emollient. Make sure patient is covered with bath blanket. The bath blanket maintains warmth and privacy. Change water and wash clothes at this point or earlier if necessary. Clean warm water prevents chilling and maintains patient comfort. Assist patient to prone or side-lying position. Put on gloves if not applied earlier. Position bath blanket and towel to expose the back of the neck, the back, and the buttocks. Wash, rinse if necessary, and dry back and buttocks area. Pay particular attention to cleansing between gluteal folds and observe for any redness or skin breakdown in the sacral area.
Okay, sir, so I'm gonna give you a back rub massage. So What do you prefer po? Lotion or okay po, lotion.
Raise the side rail. Refill basin with clean water. Discard wash cloth and towel. Remove gloves and put on clean gloves. Help patient put on a clean gown and assist with the use of the other personal toiletries such as deodorant or cosmetics. This provides for the patient's warmth and comfort. Protect pillow with towel and groom patient's hair. When finished, make sure the patient is comfortable with the side rails up and the bed in the lowest position. Proper positioning with the raised side rails and proper bed height provides for the patient's comfort and safety. Change bed linen. Dispose of soiled linens according to agency policy. Remove gloves and any other PPE if used. Perform hand hygiene. Removing PPE properly reduces the risk for infections, transmission, and contaminations of other items. Hand hygiene prevents the spread of microorganisms.